Joined by Dr. Matthew Oughton. He is an infectious disease specialist at the Jewish General Hospital in Montreal. Dr. Oughton, thank you for your time. I just want to clear this up for everybody watching. What's the difference between whether it's airborne or whether it's droplets? Aren't droplets airborne?
So there's lots of definitions that are used sometimes interchangeably, and depending on who's speaking, they may have slightly different meanings behind them. So when we talk about airborne transmission, usually that refers to diseases that can be usually respiratory diseases that can be passed by expelled, air as well as other very small respiratory droplets. And that's the same thing as talking about aerosol transmission or droplet nuclei. These are very, very small droplets that are so small that they can actually remain airborne for quite some time. We're talking about droplets that are less than 5 microns. To give a sense of scale, that's about 1/100th the size of a dot or a period. If you're reading that on the screen or on a printed page, is very, very small. And there's very few diseases that we know of that are primarily and mostly transmitted through aerosols. The vast majority are transmitted by larger particles called respiratory droplets, things that are greater than 5 microns. And the debate now is with SARS-CoV-2, to what extent can it be transmitted through these small airborne particles.
So to be clear, airborne is similar to aerosol. So let me use an example. If I spray a room with air freshener and it lingers for a while, that's what we're talking about here.
That's the same idea. Or wood smoke would be another example, the kind of thing where the particles are so small that they can float on ambient air currents. They're not heavy enough to be brought down once expelled quickly. And if they're lingering in the air for a long time, the concern is that if you have a setting in which there's poor ventilation, especially if there's perhaps multiple people close by who are infected and all expelling these very, very small aerosols into the air around them, that people might be exposed to that, inhale them, and then potentially get sick. During COVID-19, we've seen a few examples where this seems to be the mode of transmission.
Okay, so that sounds pretty alarming, but we don't want to be alarmist. But when you describe those types of scenarios, I'm thinking airplanes, for example, elevators, enclosed spaces where people can be crowded together. Is that what we're talking about here?
Those are the kinds of settings in which this could be a concern. In COVID-19, some of the more famous examples include a restaurant in China where there appears to have been transmission from one table across distances of the restaurant, where it's farther than the usual 2 meters that we talk about when we talk about respiratory droplets and physical distancing. Another example would be the famous case, I think it was in the United States, where there was a choir that was together in the same room, and although they're practicing physical distancing, they were singing together for quite some time. And in that setting of a lot of people expelling aerosols while singing for an extended period of time with poor ventilation, that certainly what we have done has acted what we've done so far by generally using precautions aimed at droplets seem to have been effective in the vast majority of settings.
Okay.
But the question is one of degree. To what degree could aerosols be transmitted? Because if it is a major form of transmission, then there's a lot more that needs to be done in terms of ventilation precautions, which can be quite expensive of an undertaking.
Doctor, I am out of time, but I do want to illustrate and highlight this makes masks more important than ever, I would assume, does it not?
Non-medical masks, absolutely. Those seem to be effective at reducing the transmission from someone who is infected but perhaps asymptomatic of both respiratory droplets and the smaller aerosols, yes.
Okay, Dr. Matthew Oughton, really appreciate your time today. Thank you.